This is the Louisiana Center for Health Equity. We are a 501c3 nonprofit, nonpartisan organization based here in Baton Rouge, but we are a statewide organization that serves the entire state of Louisiana. Our mission is to address the disparities in health and health care across the state.
What are we doing here today?
We are here today on behalf of the campaign to establish the Louisiana Office on Women's Health. The campaign consists of more than 40 organizations that want to see this policy and want to see this office established in Louisiana.
Why is this needed?
This office is needed. It is very much necessary to address the disparities that we see across the state. Louisiana is 49th based on 2020 national data for women and children. The ranking in health outcomes for women and children. 49th is not good. That is not acceptable. It is unacceptable for Louisiana to consistently rank at the bottom when it comes to the health and the quality of life for our children and our women. Good morning. I am ALMA Stewart, President and founder of the Louisiana Center for Health Equity, an independent statewide, nonpartisan, nonprofit organization. The Louisiana Center for Health Equity works to address the increasing disparities in health and health care across Louisiana. Thank you for joining members of our campaign to establish the Louisiana Office on Women's Health for today's press conference. The campaign is comprised of more than 40 organizations that have come together to serve as a cohesive voice for better health outcomes for all Louisiana women and girls. Women are the backbone of our society everywhere, from their families to the workforce. When the women of Louisiana are not at their healthiest and strongest, the state suffers for it. The campaign's goal is that by the end of 2021, the state of Louisiana will adopt policy to establish the Louisiana Office on Women's Health. And here's why. According to America's Health Rankings 2020 annual report, Louisiana ranks 49th nationally in overall health for women and children. And here are some opportunities for improvement. Poor birth outcomes, such as maternal and infant mortality and low birth weight. Chronic conditions such as diabetes and obesity. Social concerns, including gender wage gap and hunger or food insecurity, which is pervasive and has worsened during the COVID-19 pandemic. And this is just to name a few of the areas that Louisiana can improve. Women in Louisiana have fared poorly for too long as compared to women in other states. It's time to change that. Health disparities here are pervasive based on gender, race, and place. Our vision is that improved health outcomes for Louisiana women will foster a better quality of life for women and their families. This is not new. Health outcomes for women in Louisiana have ranked at the bottom of this country for many years. Social determinants of health like access to health care, race, gender, socioeconomic status, the environment, transportation, jobs, and more have played roles in the differences seen in health outcomes for women, especially for African American women. The efforts set forth in the state to alleviate these disparities have not been enough. Therefore, and that is why we propose this Office on Women's Health as a potential solution to improving the quality of life for women and their families in this state.
AAUW is part of a national organization that has evolved over the last 140 years to meet the needs of women and girls, and it continues to evolve in intersectional advocacy. I'm here to talk about the importance of establishing the Louisiana Office of Women's Health and how it will improve the lives of our families and individuals across the state. The creation of a Louisiana Office of Women's Health is vital to improving the health outcomes and quality of life for women and Louisiana families. AAUW of Louisiana supports establishing the office because we know, both as a national advocacy organization that upholds these tenets and as part of the dynamic coalition of intersectional advocates in Louisiana, that healthcare security is intrinsically tied to economic security. AAUW believes that everyone is entitled to high quality and accessible health care. Outcomes in the United States continue to lag behind many other Western nations, but more Americans are now able to access affordable health insurance and the preventative care they need thanks to the Affordable Care Act, which passed in 2010. While Louisiana leadership, with an awareness for the holistic needs of our state, strives to reach the healthcare needs of all of our friends and neighbors, there is a necessary component that is missing in our mission to serve the healthcare needs of women and girls in particular. The many initiatives working to address various aspects of women's health in the state, there's little unity and coordination amongst these efforts. An Office of Women's Health will serve to focus these efforts under one roof to improve outcomes for all of our girls, women, and families and individuals. We know that the staggering disparities seen regarding women in Louisiana can be improved with the commitment, focus, and dedication of an Office of Women's Health. Our Louisiana family and friends carry the burden of these healthcare disparities, but success is closing gaps in inequity and disenfranchisement can more effectively and more quickly be achieved by unifying localized initiatives like the Louisiana Office of Women's Health. Thank you very much.
First, I would like to thank ALMA Stewart and the Louisiana Center for Health Equity for allowing me to partner with them on this significant legislation. A huge thank you to all of these leaders behind me who have demonstrated their willingness, the courage, the determination, and the sheer grit to show up, to fight for these issues that are so critically important. We could not do this without them. The Louisiana healthcare system has been challenged. 51% of the citizens of Louisiana are women. And results show that we have not provided the resources women need to take care of themselves. We're currently second highest in low birth rates, second highest in infant mortality. Black women in Louisiana are 4.1 times more likely than white women to die in childbirth, an issue that I amended our budget to address and to look at, to study how we can come up with ways to address that. We're the highest rate in the country for babies born with congenital syphilis. Third highest adult rate of obesity. Ninth highest cancer rate diagnosis. 1 in 4 women are victims of domestic violence. Severe lack of access to opioid treatment and medication for addiction treatment for mothers and women of reproductive age. These and other issues are impeding the quality of life for women in the past and the state to enable all women to be their own best friend. Senate Bill 72 creates the Office of Women's Health within the Louisiana Department of Health so that there will be a laser focus on collecting necessary data and providing the resources and education women need. Led by an assistant secretary within the department, women's issues will have their rightful place, equal to everyone. Will always be at the table when resources are being collected. The office would also be empowered to seek out private sector grants and expand and complement available government resources. Today is indeed a great day. A great day for women all over the state of Louisiana. A great day for recognizing the importance of putting our money where our mouth is. For far too long, we've talked about these things, and it's now time for action. So I invite you to come and be a part of this movement as this bill works its way through the process and hopefully rapidly to the governor's desk. This is a clarion call for everyone to come out to recognize this gross oversight and this incredible need that this incredible team behind me has worked so diligently on. I'm honored to play a role. God bless you.
Good morning. Thank you all for being here, particularly Louisiana Health Equity and Ms. ALMA Stewart and all the partners that are behind me. You know, they say it takes a village, and today we have that village. We have the people that are standing here together, both senators and state representatives, saying the same thing, speaking with one voice, and that's what we have to do. The legislation that I filed is identical to that the senator had filed, and he's told you what that legislation will do, create the office. But let me just tell you, as a woman, I understand the disparities in the treatment of women. As a woman, I understand that we need to close the equity gap within our system in Louisiana. As a woman, I understand that I need to make the same amount of dollars as a man. And I've seen women in this Capitol vote against women, and that's sad. But today, we're gonna change that trajectory. Once we have this movement going forward, once everybody comes together to understand and to vote and to put your money where your mouth is. As a black woman, I represent a lot of people in poverty, and I understand the disparity and the access to health care. As a black woman, I understand that I need to do more to make sure that that gap is closed. And that's why I want a seat at the table, because if women don't have a seat at the table, usually they're on the menu. So guess what? I have a seat at the table today. I'm asking not only women, but men to join us as well as we move this legislation forward to better serve all of the women in the state of Louisiana. And I'm honored to carry this legislation.
And great thank you to our sponsors of our legislation, Senator Troy Carter, who is authoring Senate Bill 72, and Representative C. DENISE Marcelle, who is authoring House Bill 193. Thank you for sponsoring legislation to bring this much needed office on women's health to Louisiana. Louisiana's efforts to promote health for all women and girls must be coordinated, and it must be strategic. An office on women's health would focus these efforts under one roof to improve health outcomes and address the disparities that Representative Marcelle just spoke about for black girls and women and families. But this office will serve all women, all who identify as their gender as women throughout the state of Louisiana. And so today I'm asking for your support for this important policy. We're asking you to support the establishment of the office on the Louisiana Office on Women's Health by contacting your legislators, contacting your senators, your state representatives, and letting them know that you support this and asking them for their support as well. We also have a petition that we have on change.org. It's change.org, LA Office on Women's Health. We're asking you, everyone, to support that petition, to sign the petition and to share it with others to help us demonstrate the wide and broad and breadth of the support across the state of Louisiana and truly across this nation for the state of Louisiana to improve its health outcomes and quality of life for girls and women into the future. Thank you so very much. Have a great day. The goal of this office is to improve the coordination of the resources and services that already exist in the state and to make sure that we have in place the resources that will promote healthier outcomes for Louisiana girls and women, and that will also provide the education and the advocacy to ensure that our health outcomes are improved.
What's your reaction to what you've heard and seen here today?
It is very exciting to see the organizations and the policies, the other partners that support these policies. It's very exciting to see the enthusiasm for this office. The fact that we have over 40 partner organizations already signed on, and we're just today opening the session is very indicative of the amount of support and the level of support for this office. The fact that there is a tremendous need to do something to address the poor health outcomes for Louisiana women.